Hello, this is Dr. Shamima Sataruna from the YouTube channel Doctor to Help. Today we are going to talk about how to quickly and easily get your COVID-19 vaccine. All right, I think by now you probably all know that we got the pediatric age 5 to 11 vaccine approved. Now, CDC just announced that all people 18 and above can get the booster vaccine. Yes, you can also mix and match. If you got the Pfizer or Moderna before, you can mix and match. Not a problem. So, this is good news because it's right on time. We are already kind of late. I wish this happened even earlier, but next week is Thanksgiving. All family is planning to gather together around their dining table. And yes, COVID 19 is going to have a party too. So they're going to come, they're going to mingle and introduce themselves to every immune and non immune person they can get into. So, is there anything we can do about it? Yes, get the vaccine. So, go get the vaccine. If you didn't already get the vaccine, you want to save your own life and your loved ones around you. So, you really want to get that vaccine. And you don't want to spite your face by cutting your nose, right? You really want to get the vaccine to save your life. Believe me, those people, even young people who never had any medical conditions, a lot of people are having post COVID syndrome and they are paying for it. So I have lots of patients who regretted not taking the vaccine. You don't want to be one of them. So if you're lucky, you didn't get the COVID 19 already, in a disease form and you didn't get the vaccine, please sign up, get the vaccine, even the first dose, second dose, third dose, everything, whoever and whatever place you are, go get the next vaccine. All right. I got the first and second vaccine. My last vaccine was on March 31. So I am due for my booster. Guess what? I went to the pharmacy on Wednesday and they turned me around. They said, no, you don't qualify. You're not 65 and above and you don't have any immunodeficiency. So bye, doctor. So I had to wait for another 2 days before the approval came out. So now, guess what? Before I did this video, I went online. I made an appointment to get a vaccine tomorrow. Yes, I did it at like 2 a.m. in the morning. Yes, it's that easy. So I'm going to show you how to do it. All right. And those people who got the first and second vaccine, you probably had a card like this, right? It shows the date and everything. Make sure you take it with you. And if you forget or you lost it, don't worry. Take your ID and your pharmacy can make another one for you. If the place where you got the vaccine is closed, talk to your city and state health department. They can help you with getting that record because they are reported for whatever vaccination you get from whatever place. So they will be able to help you. All right. How can you make an appointment? How can you find out where you can go for your vaccine? Go online or even on your phone. You can text to your zip code to 438829. All right. 438829. Or if you still have questions about it, you can call 1 800 232 0233. I will go put in the number at the bottom in a comment so you can make a copy and paste and go from there. All right. So don't worry too much about it. So I live in a very small place. For me, I checked all of it out. The city health department, I saw there that they were asking for certain payments. So I was like, okay, it's hard to get appointment anyway. So if there is payments and everything involved, I would rather just go to HEB or Market Street Pharmacy where I can go online and easily. Most of the time, the city health department, when I tried to get my first dose, it was very hard to get through. So if you have a better luck than me, please go right ahead. Market Street is only doing it 3 times a week. So when you go online, you click at the pharmacy, go to the vaccination site. It will show you how to make an appointment, which days are available, and you can sign up. If you go to HEB pharmacy, that's where I got it because I called all the places. The easiest one was HEB pharmacy. So I was sitting at my daughter's school waiting to pick her up with my son, and I needed to give the first dose for my son. And I started making the appointment. It didn't give me a confirmation. So I just drove there to the pharmacy, asked them that, can you please confirm that I got an appointment? They said no, and they worked me in. They said it will take 15 to 30 minutes. They already saw me in 15 minutes and I was in and out. They told me, go shop around, just stick around for 10 minutes, make sure you don't have any reaction, and then go home. So we did that for my son. And I asked them, can I get my booster? They said no. And here I am. I'm going tomorrow. But I'm glad at least we have it on time before the Thanksgiving. Why? Because everybody will meet by next Thursday. And when the transmission happens, remember it takes about a week for the symptoms to start. And then you start giving it to other person the second time, right? So it will take 1 to 2 weeks before the first wave after that Thanksgiving is going to happen. So we need to make ourselves ready. And remember, if you already got the 2 shots, if you take a booster, it will only take a few days and you will be immune to 95% immediately. So it's not a big deal. It's time. There's still time to get it. So please do it. And those who don't know, remember, if anybody has any symptoms before going to this Thanksgiving party, you can go get home test kit. All right, you could Google search, and the easiest place is go to Walmart. There's a home test kit. It's usually only about $20, and there are 2 home test kits there. I recommend if you have symptoms, you want to wait until 3 days because earlier it may not show positive. So it will be better if you can wait until 3 days and then test it. And if it's positive, please don't go to the party. Yes, I've had patients who came to me and complained their family members were positive. They knew it. They still went to the party, and now 20, 30 other people got it. So you don't want to be that person. Believe me, people hated that person. So my patient was livid. So trust me, nobody wants to go through that. And anybody who was not vaccinated really had it hard and they really regretted it not getting the vaccine. So you don't want to be that person. Please go get the vaccine. All right. Remember, don't spite your nose, don't cut your nose to spite your face. You want to stay alive. You want your loved family members to stay alive. So please don't do that. And it doesn't matter whether you're healthy, you're not healthy. Nobody knows how COVID 19 is going to affect your body. Do you really want to suffer post COVID syndrome? I don't think so. So on HEB, if you go to the HEB pharmacy, click pharmacy, there will be on the right corner immunization. You will click on it. You will see two different on the top right hand side, you will see 2 buttons. One says COVID 19 vaccine, the other one is flu. So anybody who is 3 and above can get the flu vaccine. You have to make appointments. All right, both at Market Street and HEB, you have to make the appointment. So click on whichever one you're working. If you want to do both, you want to make separate appointments for both. So go to COVID 19. And once you do that, you will see all the choices. Is it COVID 19 vaccine for the first dose, the booster, kids? If it is your child, then you want to select the lowest one, and that is the pediatric Pfizer. So there, the top one is going to be any. Second one is going to be J&J, Moderna, Pfizer, finally pediatric Pfizer. If you are getting the vaccine for the first time, I would recommend Pfizer because it has the least amount of symptoms from my patient report. And if you got J&J in the past, I definitely want you to get the booster because J&J's immune profile is the least. So you want to get that as soon as possible for the booster. So you can mix and match for both Pfizer and Moderna. Whichever one you find available, go get it. If you have both choices, I would get the Pfizer. Pediatric, choose pediatric Pfizer, which is the pediatric group 5 to 11. If it's 12, you can just choose Pfizer. And for adult, all vaccines are usually available in all pharmacy. That is Pfizer, Moderna, and J&J. So you can choose any one of them. All right. So once you go in, you click that and you go into the page to make the appointment. And once you choose your vaccine, they will ask you some questions that did you have anaphylactic reaction before? Did you ever receive any other type of vaccine, steroid, immunosuppression, anything in the last 4 weeks? All those questions are very important. Please, please, please be honest in your answers because this is for your safety. All right, so you make sure you are safe, and so answer everything properly. And once you made the appointment, they will send you a picture, and an email. They will give you a confirmation that you got the appointment and what time, and they will also email to you the time and confirmation for the appointment. So once you have that, you're all ready. Head to your HEB, Market Street Health, City Health Department, wherever you are. Please get the vaccine. We want to be with our friends and family. I totally understand that. We're not saying don't do it. If you're vaccinated, it is safe to have a family gathering. Hopefully everybody there is vaccinated or immune. If you had the disease, remember the disease also give you immunity for about 3 months. All right, so after 3 months you still need a booster. All right, so be careful. Please do not give the disease to anyone else. Be responsible. Please get the vaccine and the booster. 5 to 11 is already approved. I got the first dose for my son. I am extremely happy. Once I get the second dose, I will have some peace. And I am sick and tired of this COVID 19. I want everybody to get the vaccination so we can defeat this COVID 19 and get our life back. All right? See you next time. I love you all. Miss you so much. I'll see you. Thank you for joining me. If you like the video, please don't forget to subscribe, like, leave a comment, share with your friends so that everybody gets the information. We want to share with people so more knowledge is spread. We want to help people. So that's the whole purpose of doing this video, is to help people spread the knowledge. So you can help me to spread this knowledge. So like, subscribe, and please share. All right? Take care. I'll see you next time. Ta-ta!